Dr. Daniele Bongetta, welcome to Neurosurgery Tales.
Thank you.
It's a privilege to have you here today. You lead the neurosurgery department at Fatebenefratelli in Milan. You've co-founded courses that shape young neurosurgeon, and you're also co-directing the very first NeuroOlympics next year in Rome. But today, I want to enter with you into a deeper dialogue about failures, mistakes, and what it really takes to be a neurosurgeon. Thank you.
Thank you. Thank you very much for inviting me.
You became the acting head of neurosurgery department at a relatively young age. What personal qualities or decisions do you think allowed you to step into leadership role so early?
I think most special qualities. Actually, one thing that I can tell you that I had the right masters. Sadly, one who was preceding me, Roberto Setti, had a very dreadful health issue. And so he and my department decided to give me the opportunity to lead the department as an acting director. And it's 2 years from now that I'm doing that, and it's a huge responsibility. But the special quality that actually is that I feel this burden actually every day, especially with my younger colleagues. And I'm always thinking, what would Roberto, what would my mentors do in these situations? I try to keep as humble as possible. Nothing is for granted, I think.
I see. Do you think that once a role like this opens up for you, it first is more like a burden or it feels like an opportunity? Because when something new happens, we are obviously excited about this, but once you step into that role, you kind of see the other part of it. So what do you think?
Quick answer is both. More detailed version of the answer is that there's a lot of bureaucracy, a lot of legal responsibilities dealing with this role, and this is it's very heavy on you when you're in order to bring also back into your family, try to shield them, from the responsibility, from the legal aspects, from these not so surgery related details necessarily. So especially in the first one, it was certainly a burden. It still is a burden, but also on the other hand, it's an opportunity. I repeat for also an opportunity to be able to try to improve also the training and education of the younger colleagues and try to do the right things, try to avoid mistakes with young colleagues. It's very important for them to be kept on the right path.
You also co-founded the Neurosurgical Basics course to train residents and, as you said, younger neurosurgeons. What gaps in education did you see that pushed you to create this program?
Yeah, I founded that with Cesare Zoya, a colleague and friend of mine. And we were just out of residency, actually. And we were looking for courses, and all the courses was very highly specialized. So how to clip this basal aneurysm, must do super complex skull-based surgeries. But we felt that, surgery is more like in craftsman. There was nobody that really showed you the ropes when you are at the very beginning. So how to deal with very simple things, how to manipulate the microscope, how to use drills, in basic sutures, and how to train on them. So we try to feel, since we learned not that experience, but we mastered these simple things, these basic things, we thought, well, why not try to pass on to the younger generation what we learned so far? And this get to the attention of some students, then with the aid of the National Society, we made a lot of these courses, and it's something that's passed on. We pass the torch to the newer generation that are now organizing this kind of courses.
And what advice would you give to young neurosurgeons who feel the weight of impostor syndrome? Because you also wrote an article about that, and you talk about this, something your own research showed affects the majority of trainees.
Well, to be a neurosurgeon, I think that you have to have some kind of, deviation. So you have to be very, very going for high stakes. We deal with the most noble, I think, issue in the human body. So it is normal that dealing with these things, especially with people, residents, been through so many hours of study, they might feel overwhelmed by the responsibility they get in touch with the actual neurosurgeon. And my advice, that's one that helped me, actually, is to look out for the great surgeons. And all the greatest surgeons that I've met were the ones that are more eager to be open about their difficulties, open about how they overcome the difficulties in training, how they manage some complications. Throughout all my experience, all the best ones, they always have been very, very open about how they overcome these difficulties. And so if you are stuck with an impostor syndrome or something like that, look up for the ones who actually made it, and the thing that made it, that they become neurosurgeons to you, and you feel, I think, an empathy between them. They become that, but they also were resident before. They've been there too.
Do you think it ever ends or
Yeah,
never?
yeah. In the back of your mind, I think that it's good to have something still keeping you a little bit on thin ice, you know.
Mm-hmm.
But when you think that you're done in your training, I think you're done in your practice. You always have to try to empower yourself and train yourself in being better, avoid complication in sharing expertise, and also younger generation. But I think the real experience sometimes it's like takes out the huge burden in doing the actual practicing during the surgery. Sometimes you're really alone when doing something. You are, especially in this case. And sometimes if you have a bad case of imposter syndrome, you might be overwhelmed and don't want to do this. I'm not able to do this. And I think that most of the residents are able to do what they've been pushed to do by their mentors. They just have to feel that can do that. The experience gets you there.
I see. You've worked on fluorescence-guided surgery and even designed a low-cost detection system, which is amazing. Do you think innovation in neurosurgery is more about high technology or it's simple creativity?
Well, good mixture of both. And I feel world there will be very advanced technology and very cheap and available for also income countries. I think that technology is of paramount importance right now in neurosurgery, but I think in every surgical specialty. And that's the thing that is going to empower future generations to be better than we are. So I've published with Cesare, the guy that's saw before, a paper in which we try to identify a formula what makes a good neurosurgeon. And let's say this is talent, so you have to have some kind of manual prowess, multiplied by dedication, so you have to be willing to put on effort to become a good neurosurgeon, multiplied by experience, and everything divided by bad luck, which is where we believe in God, a lot of surgery, very superstitious, and divided also by individualism. So if you are alone and by yourself, you don't share your complication, you're not sharing anything with anybody, you're going to be a bad surgeon. And moreover, we try to identify that the trickiest part of this equation is experience. Get back to the experience once again. And we try to identify like brackets, which is training multiplied by education, and everything is empowered by technology. So in the modern era, we have a lot of tools. The technology gives us a lot of tools. Where there is new navigation, where there are online webinars, simulation, augmented reality. And you can train and educate yourself a way better manner than ever before. And everything is empowered by technology. I'll give you a small example, which is very, very simple to understand, which is neural navigation. Neural navigation system is more or less like a GPS system that allows surgeon to look up in real time, indicating with a pointer with the patient the images. So you can identify anatomical structure based on the MRIs or CT scan they've done before. So the old guys, all three guys I see in the very beginning of neurosurgery, microsurgery, they did it without, they did very, very complex surgery without neural navigation. And they get there, they get that experience by doing surgeries on patients. I think the technology right now empowers a first-year resident to get at the same level just because of the correct use of technology. And I think that the correct technology thing is when it's simple and it allows for not to have hero surgeons, but to have a very high level of the average neurosurgeon. Just what we are going to aim, I think, as a whole as a neurosurgeon. Everybody should be able to perform a high level of surgery.
When performing these kind of surgeries, like the really good surgeries, you can do a bad surgery. This is not the goal of neurosurgery. When you walk in the OR, do you feel more like an athlete preparing for a match, or more it's like an artist that's going on a stage?
Yeah, definitely more an athlete. And the reason why is that you have to prepare yourself. The artistry side left more room for improvisation. During surgery, you have to be prepared. You have to painstakingly look up for charts, look up for images, try to study everything you can before even a simple surgery. Then you have to be prepared for the actual performance you're doing. And during the performance, you have a plan A, plan B, plan C. Then surgery sometimes gets you to improvise, and you have to improvise. But if you have all the things that you could be to be prepared before, you are in a better state of mind also to be able to improvise. I'd like to think that all my colleagues, and I think myself, I try to do that, we are more like not at the level of basketball, more like Ron James or Yannick Sinner or Kobe Bryant, obsessed with trying to be as prepared as possible just before the surgery, rather than being an artist or letting, we'll see how it goes, how it plans out during the surgery.
Yeah.
They're not ethical for the patient.
So if you could design the perfect operating room or the operating room of the future, what would it look like for you?
Well, difficult question. First and foremost, it should be an ergonomically, as ergonomical as possible, in order to let the surgeon and everybody involved being in a good place, moving in a correct manner and the more fatigue-less possible situation. Then potentially something that avoids X-rays. We rely usually on X-rays, especially for spinal surgeries or in vascular surgeries. And this is a burden also for the patient, but also if you are in a high volume facility, it's also an issue for the operators. And first and foremost, just thinking about what it could be in the future, I'd like to have a report, lots of data about how the anesthesia guys are dealing with the patient. So have an integrated data collection. And I think that this is the future, and maybe machine learning things are going to help us try to see what are the variations in blood pressure, ventilation, everything, all the setup, anesthesiologically speaking, and surgically speaking of the patient, an integrated data set would help us also to perform better surgery, to raise the safetyness of surgery. So lots of monitors, lots of something contradicting. More ergonomically speaking, more ergonomic sound, but also a lot of sensors and lots of data collected.
Yeah, data is everything today. So it was always, but yeah. Today we have more opportunity to collect more data and then make some conclusion out of it. You helped create a conference called Mistake on the Lake, focused entirely on complications, which is, I think is something that has been done for the first time. So I haven't heard of something similar to this.
I think it's a manifestation of what I think the new generation of surgeons should be about. You can learn from the killer surgeon that show you, this is the most complex case. I have these trophy cases, and look at me, I'm the most wonderful hands in the world. It's not like that. We have to get on with that as a collective of neurosurgeons. And I learn from my mistakes, and I learn from my friends' mistakes that they show me what they did wrong, and hopefully I won't be doing the same mistake the next time. Expanding my own experience. If I sum up my experience with the experience of all my peers and all my colleagues, I get a full, huge experience and try to avoid more conflict. And once again, I said, all the best surgeons I've met, all the best ones, they are very, very eager in sharing their competence. Because sometimes it's also something that you take out of your chest. And you are with a panel of experts, as it was in our conference, and you say, I've made these mistakes. Some things I've focused on and I've seen that I've made a mistake. Sometimes you have just blind spot. And you offer it to the audience and say, tell me what did I wrong something here? What you've done in this situation? Because the ultimate goal, I think, is to empower yourself trying to avoid the next complication for the next patient.
Mm-hmm.
It's only about sharing experience, sharing complication that you can get to that level as a whole, not as a single one, as a neurosurgical community.
Yeah, I think this is very important because nobody can really understand this complication unless it's another neurosurgeon. So it's very important to discuss and have their opinion and just to talk to someone and they understand you. So it's already kind of easier. Do you think it's going to be more conferences like this?
I hope so. I really hope so. Not only, well, we made it subtopics in different spinal, skull base and stuff like that. But I also hope that it's going to be a customary thing in all the congresses, a subsection of complication avoidance. What did I do wrong, or how to avoid this complication? I've always loved my mentors showed me I did this, so I learned not to do this. This, I think that I repeat myself, this is the only way as we can push forward as a collective, the surgical community, in sharing complications, because, you know, when you are in every field, you know, when you are in the pioneering era, you go by trial and error. We are not in that field anymore, I think, in surgery. We still have a lot of things to do, lots of improvements to make. In some things, we know what we can, and especially we know what we cannot do. And so sharing to others, avoiding others to do the same complication that you might have or you have seen in other patients, it's something that should be compassionate.
Absolutely agree. What do you think will be the defining challenge for the next generation of neurosurgeons and how they should prepare for it? Can they prepare for it?
Well, it's something that we discuss, especially in the younger section of both European and Italian society.
Mm-hmm.
One of the main issues is that the case load right now is getting thinner. So we try to operate less because we have new technologies. You know, we have new ways of delivering radiation therapy. It could suit to avoid to operate on some tumors. Some chemotherapies are definitely there, hopefully, in fact, avoid us to operate for some patients. We also take the case of vascular surgery, you know. In the last century, masters, the pioneers of the microsurgery, they had lots of vascular surgery to do performed. So they learn how to create aneurysms and lots of areas, and they get experience in doing that. Right now, in vascular surgeries, it's taken away a lot of this practice. So it's impossible to have the newer generation to have as much exposure to cases as it was. So I think the challenge is to use simulators, maybe the AR, but also simulators, physical simulators, to try to be already there, to try to get the dexterity, to get our cerebellum already there, not on the patient, but on simulators. So when it's the case, it's an emergency case, and we have done anything in the past 7 years, for instance, we've done a lot of simulations then. So it's not you're going back to your CDC and we don't know everything about it. It's going to be, I think, just like in aviation, you have to do continuous training and continuous simulators of emergency setting. I think it's going to be the same case with surgery, but also in more surgeries, getting to get hours and hours of simulation.
Yeah. Next year will mark the very first NeuroOlympics, which you're co-directing. For someone hearing about it for the first time, what is this course really about?
It's going to be a course congress from from May 20th to the 22nd and 26th in Rome. And the idea behind that, we are a group of friends who organized that. It's that we wanted to take together two aspects: the surgeon, the neurosurgical aspect, so the training, the congress aspect, and also the concept of sports mixed together. That's because we thought that there are lots of analogies between it, especially in the fact that I already mentioned before. We are, like, continuously praying and continually trying to getting better at our craft and what we're trying to do. And sometimes it could feel also like we are racing with ourselves. You need to meet your masters who are already on an advanced stage in research, doing something in sports in which maybe they are not that good as you are, because maybe just because of geographical issues. It could be something that gets a sense of community. The masters have been residents too. They've been there. Moreover, sports are, like we believe, the sports are something that really relies on teamwork. So to try to push the concept that everything is a teamwork. Also, the progression of neurosurgery is a teamwork. It's not a race; it's a collective effort. We all have to try our best to empower the neurosurgical community in avoiding complications, in try to evaluate how technologies could empower us to be better surgeons. So basically, it's gonna be something which is normal, let's say, course or congress. Some also courses with sutures or sports industry-driven workshop, but also it's gonna be sports involved. All the venues in the Olympic Stadium in Rome, and there'll be also through the first 2 days course dedicated to get into sports. This could be track and field, it's going to be the team sports. They're just organizing that. It's going to be, I'm very excited to do that. I think it's a social event. It's going to be useful also for, especially for the younger one, to get in touch on a really not sport, but sportsman like fashion to their masters. It's going to be using that. We get a lot of hype about that. I think it's going to be very depending.
So how should we prepare for it? Should we start training for marathons or?
Well, no, you gotta be training also on sports and also on
Okay.
neurosurgery. It's the key of life, you know. Also, if you think about what I said before, the burden that you take in doing neurosurgery, there are lots of bad ways in dealing with stress, in dealing with burden that you get in doing complex surgery. And we all know the bad ones. Sports is one of the good ones. This issue also starting to say that the burnout syndrome is way less in those who practice sports. I think it's some pushing and trying to pushing the culture of well-being for surgeons. So not a race between us, but a race of us to train also in neurosurgery, but train also in your well-being.
Do you think is competition the best way to reveal what a surgeon is really made of?
Well, as I told you before, to be a neurosurgeon, you have to be a competitive one, especially yourself. You are challenged with one of the most, if not the most, complex subspecialties in surgery. So it is a competition between very competitive people. But nevertheless, if you also, what we try to do with the competition congress, are you to make yourself in a competition, in a friendly competition, in a sports environment, it suits, the conflict. It makes you feel that we are on the same boat, everybody, on this very, very complex thing which is called neurosurgery, and we try to do our best. Maybe just like in team sport, if we try to help each other, we'll get to the best result possible.
And lastly, I prepare a very personal question, I guess. In those quiet moments, let it that be after a very long work day or before a very long day, do you ever ask yourself why you choose neurosurgery and would you choose it again?
It's surely is a very, very personal question, because it has been so important for me, this choice when I chose to be a neurosurgeon. The short question is yes, I would do it again. But there's a huge but. I have 2 children. If one of them asks me if should I become a doctor, should I become a neurosurgeon, the answer there is no. And I try to elaborate a little bit. Neurosurgery, I think when you have the luck, you have the patient that comes back from rehabilitation or wakes up and it has no deficit and you just cure them, it's one of the rewarding things that you could do. Your life has meaning, your worship study has meaning. Sadly, that's not always the case because of your yes, I'm not sure, and also because of the performance. Even the best surgeons, they have very bad outcomes. It's because of the performance. So this takes a huge toll on you. So I was telling before about the problem, the issue of burnout, which is a real problem. I myself try to shield my family from all the complications, from the bad things that happen. And I don't know if it's the right thing to do. And this somehow it's something that you keep inside and rottens you a little bit. I'm lucky to have a wonderful family, so I have a lot of recharging batteries when they come back. But also, there's another issue. I know there's differences between countries, but I think there's actually for most of the surgeons throughout the world. You have not an impostor syndrome, but you have a complex syndrome about avoiding. They try to make sure that your family is not getting any less just because you're working long hours and because you're dealing with such complex things like being a children. So I'm always in a hurry, try to get back to my children to be at the team sports activities to be there for it. But I'm always feeling like I'm missing out something, just because their dad is a neurosurgeon or husband, because my wife. I take something away from them, and it should not be like that. I don't think there's a solution to that, and you have to try to have a way of dealing with yourself first. Synthesizing, I would do that again because I know myself. Like if one of my kids say I want to do a surgery, again that's on. There's a lot of things that not there heavy on your family life.
Thank you so much for sharing your thoughts, and thank you for having this conversation with me. Thank you.
Thank you.